Monica Unni. I'm a physician's assistant and own Loop Wellness Clinic in downtown Leesburg, and we also have a small satellite office in Old Town Alexandria. And we primarily do hormonal management. We also do some weight loss and IVs and peptides and a whole bunch of just wellness offerings. And we pretty much serve men and women. Age range can vary from 30s all the way to, I think our oldest patient is like 87.
Wow, that's awesome. Very cool.
And I'm Erika Schilling, certified, or rather, doctorate of nursing practice. And my background is in women's health.
Okay, awesome. I can't wait to learn more about just everything you guys do. So, Monica and Erica, for listeners meeting you both for the first time, can you share a little bit about your backgrounds and what led you into this space of functional wellness and hormone optimization?
Okay, I'll go first. So my background is actually in emergency medicine, and so I spent almost 20 years in the ER. I started in a small ER in West Virginia, and then spent most of my time here right in Inova Loudoun in the ER, and it was a fabulous experience and really just taught me everything about medicine. But the last 10 years of my time in the ER, it was really about just connecting with patients. And, in the ER, it's like an in and out scenario. And I was always the lowest performer because I always spent more time in the room with the patients. And so that was always like hey, we've got to get your RVUs up. Can you see 5 more people through the course of the day? But that kind of just started the trajectory of I really enjoy the continuity of care and the one-on-one with the patients that I was seeing. And then from a roundabout way, hormones was introduced to me, and it really sparked a deep interest in wanting to learn and wanting to manage patients with hormones. And so that just kind of started the trajectory of, while I was in the ER, finding a mentor, being trained, and kind of just diving deep into hormonal management. And honestly, it's such at least back then, I feel like there's more patients that are aware and self-aware and know that they can learn more about it, but a taboo topic. And truthfully, coming from the emergency room, it was really taboo. Oh my gosh, what are you doing? You want to manage hormones? And so it was a very eye-opening journey, and led me to opening up Blue Wellness, and it's been amazing.
The rest was history,
The
right?
rest is history. Yeah.
That's awesome. How about you, Erica?
My medical background started about 27 years ago or so. Joined the Navy. I was always medical, did some clinic/emergency style medicine while in the Navy, and then went to nursing school, and I was just kind of thrown into labor and delivery. And I was like, this is not my thing, but it became my thing. I became very, very good at it as a labor delivery nurse, and then took that passion to become got my doctorate as a midwife, nurse practitioner, and that led me down this women's health journey and I found a lot of passion in it. And I love delivering babies, but as I was going through a transition in my life and my age, I found a lot of passion with hormone management and found Monica, and we started working together. And I do still deliver babies on the side, but this is a very much of a passion that I found, managing hormones and just a fitness and wellness. Everyone has their journey, right? And I feel that I would love to encourage people down that road and live happy, healthy lives. And we absolutely could do that through this hormone management.
Absolutely, that's wonderful. It's so cool that you get to fulfill that while also being able to deliver babies also. That's so amazing. Your background in women's health and midwifery brings a unique perspective to the practice. What, drew you to hormone therapy, and how has your personal experience as a patient influenced the way you care for others?
Yeah, that's a great question. So what drew me to hormone therapy for myself was just going through perimenopause. Early mid 40s, you're feeling all of this stuff, from your emotions going up and down, your heat temperature up and down, and all of these things. And found hormone therapy through my best friend who was working in a clinic, who introduced me to Monica. And as I was transitioning out of the Navy, she's like, look, you really need to do this. You're great at it. You're great at women's health. And so that's how I kind of got into being at Loop with Monica. And yeah, I think that answered the question.
Yeah, it
okay.
definitely did. It was kind of just like your calling, I feel.
I feel like it is. And personally, it feels good to be managed hormonally, and I know the difference, and it helps, from day-to-day stuff, your sleep, your fitness, your mood, all of these lovely things that are kind of dynamic through this age. And we want to live healthy, and that's what we're doing.
Absolutely. It's great advice for all of us, too. And Monica, your journey into hormone therapy started in a very unexpected way, from a conversation with a patient to connecting with a mentor.
Yes.
Can you walk us through how that moment helped just clarify your path?
Well, I wouldn't say it was necessarily a moment. It was just like, it was a process. So I already knew I wanted to leave the ER, and I knew that I wanted to spend the rest of my career helping patients, but in a different way. And so when I did stumble upon a patient that was managed with hormones in the ER when I was suturing them up, and it was a very kind of profound moment. It was a very interesting conversation and led me to just independently, research hormones. And she was managed with pellets. And once again, from the ER world, that's like, what? And so, so that just sparked my journey, and that was years ago. And so, when I did, and it was fate how I met Dr. James Cannon, because I knew I was going to open up a practice, and I knew I wanted to focus on wellness, holistic medicine, and I had all these ideas of like, I want to optimize people's health. I want to help them feel better. How can I do this with fitness? How can I do this possibly with hormones? And so when I encountered Dr. Cannon, just like I said, through fate, because I called the board of medicine to ask a legal question, and they were like, I think I have somebody that can call you. And I thought that was going to be like a joke, like who's actually going to call me? And literally I got an email the next day that was like, hey, I'm Dr. Cannon. I hear you have some questions. So we set up a phone call, and that was a 2.5-hour phone call. He was absolutely amazing, and so it's just such a unique connection. So he owned a practice in Chesapeake, Virginia, and Erica's best friend is who worked for him. And so I drove out to Chesapeake, well, after our phone conversation, because he was like, listen, I mean, everything that you talk about, what your passions are, how much do you know about hormones? And I was like, I've touched the surface just because I've been interested, and I've had some, encounters with patients and et cetera, et cetera. So everything I know is just from independent research. And so when I went to his practice, and I literally went the very next week after a phone call, and that, I guess, was like the aha moment, because I was much younger then, because I've owned Loop now for, I don't know, 7, 8 years. And this was years before that. So I was not in, perimenopause age range. And so I just wanted to help patients, and I connect with patients, and it's a very important part of how I practice medicine. And so I just wanted to do more for people. And when I went to his practice, and he does operate differently, and he's like an in and out, like a machine, and he had, I think, literally like 30 patients back to back, and I am not kidding, every single patient was managed with hormones, and they, in that like 8-minute window of time, wanted to just share everything with me. Like, oh my gosh, this is the best thing I've ever done. I don't know why my doctor doesn't offer this. This has been life-changing. It was just person after person, male, female, wide age range, that I literally was like, where has this been? Why do people not know about this? Why do primaries, gynecologists not advocate for this? And that was it. So that was, I guess, like that aha moment in his practice, where I was like, I will spend the rest of my career doing this, researching this, advocating for my patients, trying to get more patients to do this. And I'm very much detail oriented. I will only do things if I know I'm doing it 100%. And so I was delayed to kind of start my practice, because I was like, I need to know everything in and out. And the truth is, you never do. And that's, when you feel like you do, you probably shouldn't be practicing medicine. And so that started the journey.
Okay, wow. It was just meant to be.
Yeah.
Like that.
Yeah.
I love that story. That is so cool. And the
I
way
really
that
do feel like it was meant to be. And then bringing Erika on, and just that connection, and through our mutual friend, because so Dr. Cannon became my mentor, and I trained under him, and then I became very good friends with his like office manager assistant, Buffy, and then And then that connection was made, and it's been amazing.
Wow.
Yeah.
It's like a pieces of a puzzle just all
Yeah.
fit together
It
to
really
make a
is.
beautiful picture. That's
Yep.
awesome. And, a common theme that you both mentioned is patients feeling truly heard. Why do you think that's something so many people are missing in traditional healthcare settings?
Oh, I have a,
We probably have the same idea.
I know. I mean, I feel very strongly about this, and it's, insurance kind of dictates how primary practices are run. So it's really truly I think, of no fault to primary care doctors, to GYNs. Like, you've got 15 minutes in and out, which is why I think so many doctors are trying to move into concierge practices, pay practices. It is not to say, hey, well, I just want to make all the money. It's because you really don't have an opportunity to practice medicine the way that you want to practice medicine. And that's even relatively true in the emergency room, right? So you've got 15 minutes in and out, and hormonal management is about quality of life. It is about optimizing how you feel. It is about reducing your risks, disease and health prevention benefits. And so those things, they do matter, but they're not really assessed, and do they matter when you've got a 15-minute window and maybe 30 minutes for a physical. But truthfully, from the perspective of the primary that's running the physical, their job is to screen and ensure they're not missing something. And is there cancer? Is there something that needs to be worked up? It's not about, are you happy? And do your joints bother you? And how's your libido? And those things that improve quality of life. So it's unfortunately just the way that Western medicine is practiced. But what I would hope for is that primaries were a little bit more on board with hormonal management, that they could say, hey, listen, if you're experiencing X, Y, and Z, you should go see so-and-so. That's what I feel could possibly change, and maybe doing a little bit of independent research to know that this is beneficial, this is protective, and really most patients are candidates. So that's my answer.
Yeah,
Yeah.
I would agree. I left a practice where I was in the clinic seeing women every 15 minutes, and I just couldn't keep up with it to the degree I wanted to, that my patients deserved. And you can't fit, like Monica was saying, you can't fit all of these things into such a small visit. So being able to do that and listen to our clients, both men and women, what are the things that are going on? And it's not a one-size-fits-all model, right? People metabolize things differently. So, and that's where we come in as experts in our field now with the hormones, is that things are dynamic and they change throughout your lifespan as well. So we're constantly following up as these symptoms or people's lifestyles change. Well, we're here to be dynamic with you and meet you where you're at.
Really just taking that time to kind of listen, diagnose, and find something that works best for them. It's kind of just a very personalized process, I feel.
Very much so.
That's awesome. And to go into that, you spoke about taking a very hands-on kind of concierge style approach, even beyond hormone care. What does it mean to you guys to truly advocate for your patients?
I
mean, it means hearing them, again, meeting them where they're at, but also following up. Not just throwing, some medicine at you or here's these hormones, we'll see you in 3 months. We've got connections with our clients, and we know, what's happening with them personally and how that affects how they're feeling as well. So I think knowing more about your clients versus just what's on that piece of paper or their lab results, because it's not just the lab that I'm looking at, it's the whole person and the whole family, to be honest. So we hear, what's going on with people's families and how that is affecting their lives, and they want to share that stuff with us.
Sure. Yeah, I feel like lifestyle definitely goes into it as well.
Right.
100%.
And I mean, I'll add, like, patients that end up coming to us and being our patients, like, that is something that A, we value, but B, like, I'm here to look out for you. And so, yes, predominantly what we do are hormones, but the screening that we do at that initial assessment and consultation, it kind of sets the stage for everything. So I'm here to track you. I am here to make sure all your ducks are in a row, meaning unrelated to the hormones. I very, very frequent conversations about my recommendations and suggestions for other things that are unrelated to hormones. It's just like, I'm here to advocate for you. I'm here to help you advocate for yourself when there's other things that should be assessed and addressed. And so it's, it's important to us that patients understand that we know that there's other places that they can go. And so we value the fact that they come to us, but you're going to get a lot out of it, more than just your hormonal assessment, because we're invested in you as a person.
Yeah, no, that's wonderful. And I mean, to go into that more, I mean, many of your patients describe their experience as life-changing. What are some of the most meaningful transformations you've witnessed through your work?
Go for it.
Oh gosh, I mean,
There's so many, right?
There is, because so Erika, with her background, there is an element of instant gratification, right? So
Yeah.
you deliver a
Yes.
baby and it's just heartwarming and all of that good stuff. In the emergency room, there is not a lot of instant gratification. There's a lot of just trying to explain to somebody that, hey, listen, you're here, but a lot of times we can't tell you what's wrong with you. I can just tell you you're not going to die. You can go home, you can be discharged, you don't need surgery. But there's a lot of questions, right? And so, doing that for almost 20 years, this is completely different, right? And so, not that you get instant gratification, but you're along a journey with the patient and they see benefits within, everybody's journey is different, but I mean, I would say within 4 to 6 weeks up to 3 to 6 months, patients will feel so much better. And oh, it's rewarding, especially dependent on how significant those complaints are. Anything from, hey, I thought my marriage was going to be over, and you've really helped with the ability to connect and my mood to kind of stabilize, to the woman that's like 65 and has been told, hey, I shouldn't do hormones, and they still are having hot flashes, night sweats. They have significant brain fog. They feel like they can't even function, and they come in and you're like, you've changed my life. So it's rewarding. It's so rewarding. And it's why we do what we do. And I would say that the vast majority of our patients feel some element of benefit. Otherwise, they would not keep coming back. And so, and that's not to oversell. It's not like you change everyone's life. You get improvement, period. That is what the expectation should be. And it's rewarding.
Yeah. To be able to make those kind of impacts and really just improve quality of life in those ways. I mean, there is nothing just more beautiful than that, I feel. And for women navigating perimenopause or menopause, there's often a belief that they just have to deal with it. What would you want listeners to understand about the options available to them?
It's tough because so many women do get that, oh, just deal with it, this is part of life, congratulations, you're making it through menopause, right? You're doing this transition, it's normal, suck it up kind of situation. There are so many options. We've got topicals, we've got oral pills, we've got the pellet, which and we, when we see a client, we talk about all of these different modalities, rather, and see what best fits your lifestyle. Because it's just, again, it's not a one-size-fits-all model, and you'll hear me say that time and time again. So it depends on what's going to work for them and how they respond to things, how much time they're willing to commit to, because some of the modalities take more time than others. So that's how we kind of navigate that process.
Sure. It's a process, but not an impossible process.
Not at all. Once it feels good too, it becomes easy.
Yeah.
And it's a lifestyle, right?
Yeah, everyone deserves to feel better, to live life just with a little more ease. So that's awesome.
And I would tell, anybody that is listening that just educating yourself, right? So, some patients already know, like, oh my gosh, I want to do hormones. I want to do X, Y, and Z. And they've done some research and they're ready to roll. And then you have a whole nother perspective of fear, of uncertainty. Gosh, I don't want to do anything that's going to cause cancer. Oh, I have family history of breast cancer. Oh, I have endometriosis. I'm not a candidate. And so all of that is inaccurate based on what hormones we're discussing. And I think understanding what benefits you get from what hormones, what the safety aspect of that is. And so it's really about understanding and education first. And that's where Eric and I come from. That's our platform of, just come to me so that I can give you all the information. And when you feel you are ready, which might be now, might not be now, come back. but you should be informed. You know, everyone has to advocate for themselves and for their family members. And I think just understanding that you have potential options, what those are, and how they can benefit you. So I would say anybody that is experiencing symptoms and are feeling a little uncomfortable or are feeling a little out of sorts, there are definitely options. So come learn about them.
Yeah, just have to reach out. And I mean, to go into that, you know, like you said, education plays a significant role in the work you guys do with patients. How do you balance informing them while also helping them feel confident and not overwhelmed?
That's a good question because there is so much information in the arena of hormones. And so I think what we do is, you know, we're going to meet you where you're at too. We're going to break down the information for you, you know, go over your lab works. Well, why are your labs looking like this? How did they respond to the hormones? And so we take a lot of time to educate and just break things down to a simple way of understanding. And a lot of our clients will be like, wow, thank you for explaining my labs to me, because there hasn't been another provider that has done that. But we want people to understand why we recommend this or how this can help, and to be an advocate for yourself so that you can go and speak to it when somebody asks you a question. Why are you taking this? What is it doing it for you? What are the risks? What are the benefits? So we need to know the whole picture. We want all of our clients to understand that and buy into these therapies, because if you're not bought into it and understand what it's doing for you, then you may not understand the side effects or actually recognize what it is doing for you. And if you don't know that, then we can't adjust things, or so that's, I think, just the knowledge.
For sure. I like how you bring up how you break things down and you kind of show the reason behind things. I think it definitely gives more ease in knowing why this is maybe a path we're taking. You know?
Yeah, and
100%.
empowerment, right?
Yeah,
So
absolutely.
you want to feel empowered in your therapies and have that control over you.
And I would say, you know, like Erika said, we do meet you where you are, but, you know, even at that like initial consultation, you know, so what I tell patients is that, because we spend the first probably 20 to 30 minutes, you just telling me what all of your issues are. And that's done really twofold. One, so that I can properly guide and educate on how the hormones are going to help you. But B, it's also our job to assess what your complaints are, to say, this is actually not a hormonally related complaint. This requires a further evaluation by somebody else. But patients can get overwhelmed with the information, and that's also our job, to assess the person sitting in front of us, to understand, like, okay, this is a little overwhelming. This is kind of, I need to explain a little differently. But I do often, after an initial consultation, say, hey, I don't actually want you to do anything today. I want you to process everything that we've talked about. I want you to formulate some questions, and then we're going to just do like another 20-minute phone call next week, so that we can kind of revisit everything as you've had time to think about everything that we've talked about. And so that is meeting a patient where they are. And I would say 90% of the patients are like us, busy, no time. They're like, no, I'm here. Okay, that was great information. All right, let's go. Okay, and then the other 10% are whatever, right? It's
Everybody's different.
Let me meet you where you are. There is like a zero pressure. It's not like a push. It's not like a sell. It's everyone should be informed, and everyone should know that they have options. And if it seems like it's a little overwhelming, then hey, let's take a step back and let's do this again in a couple of days, and then see what, you know, where you are and what you might want to do.
Yeah, that's super reassuring to know that you can kind of adjust to, you know, however the patient needs to kind of take in that information. Wonderful. And kind of a pivot, you mentioned hosting events like your upcoming patient appreciation for weight loss clients. How do experiences like that help strengthen relationships with your patients and community?
I would like to think that it really does help strengthen it. So I'm not, this isn't hokey, like it really is true. Like I might be at the end of the night or like preparing for my patients the next morning, and just that like overwhelming, like, oh my God, I'm so tired. And then I start my day, and it's fun. It is fun because everybody I'm seeing, there's a connection that has been made. And so it's just like, hey, how was, the college visit that you did 3 months ago? Because we see patients like every 3 to 6 months. And so it's like I'm seeing friends every day, in and out, in and out. And then, the ones that I'm just meeting, it's like okay, I'm meeting a new friend. Let me get to know you. And so tell me more about like your life. Tell me about your occupation. And it's just, I don't know. I love that. I thrive on that. So then when we do events, and this one, our weight loss event is May 7th. Okay, so our weight loss event is May 7th, and I'm super excited about it because it's celebrating everybody that has come through our door to do weight loss. And so even if they have segued off, or they are wanting to restart, or have been successful, whatever it is, but we have connections with these patients, and especially the ones that have been successful through their journey. It's a party. It's like, let's celebrate and let's offer you things at like the cheapest price point that we can, and to really celebrate you. And so it's fun. It's fun because we make it a point to make sure that there are more ties than just like a business operation and I'm just here to do your hormones. I think patients call a lot for things that really maybe they shouldn't be, but it's because they feel comfortable, and because we have made it an environment where they can ask me just the most random things that I give them some guidance and education, and then say, should probably follow up with your primary about that. But that's what we do, and that's why we love what we do.
Yeah. Oh, I just love that. And especially with the events too. I think that is such a great opportunity for everyone to just connect, share progress, share advice, things like that. What a great opportunity. And as Loop Wellness Clinic continues to expand its reach, what are you most excited about in this current phase of your business?
What are you excited about?
Well, I am excited about our newest addition down there in Alexandria. It hits a bit of a different dynamic of people, meaning there a lot of business people in DC and that hustle and bustle area. I work well with that because I am a very timely person and they're very timely. So that works well. And I feel like it's like my baby and it's growing. And so thanks for my baby, Monica.
Yes. It's adorable. It's really it's a very cute little practice out there.
Yeah.
And so,
I love that analogy.
So that's what I'm most excited about. And also we're bringing on new things. We practice evidence-based medicine, and evidence changes, and there's a lot of great things out there, such as the peptides that we commented on briefly, and that goes into all of this wellness stuff. As we're aging, these things kind of go down, so it's fun to get those perked back up and to see people feeling how they felt like they in their early mid 30s, and just they feel good because things get depleted over time, and we want to age healthy and be able to enjoy our retirement and all of that good stuff. So I'm excited about this new practice out there. It's growing, and it's fun.
I gotta say, it's probably so rewarding to be a part of that and to see the improvement, see people feeling better. I mean, I just feel like that's such a full circle moment to be a part of.
Yeah.
For sure. And for anyone listening who may be curious about hormone therapy or looking for a more personalized, patient-centered approach to wellness, where can they find you and learn more?
They can check us out on our website, so www.loopclinic.com. And we do have Facebook and Instagram. And honestly, if they call us, my office manager, assistant manager, really kind of give just a general snippet of, hey, what are you interested in? Which way can we direct you? And can give just some simple guidance just over the phone, and then tee them up for whatever the next step will be, whether it's lab work or scheduling an appointment with one of the nurses. So it's really kind of like a tiered approach. But if you have a patient that calls and wants some general information, but still isn't sure that they want to do labs, then they'll schedule a complimentary phone call with one of the nurses, and then the nurses can do a little bit of a deeper dive on what their interests might be in, and then labs. because labs are really important. So, to sit down with Erica and I to go over really anything in any depth, lab work is really important to kind of segue the conversation into what are you potentially a candidate for.
Yeah, to really assess. I think that's great. That's
Yeah.
so great. And as we wrap up, is there anything either of you would like to add that I haven't touched on today?
Gosh, so I would say I think we touched on just about everything, but I would just like patients to know that we it's not a one size fits all. We do offer all different types of modalities, meaning different ways that you can be managed with hormones. We do offer a variety of weight loss options, but it is very much guided with provider involvement, and we have a functional medicine nutritional nurse. Allie Burton is amazing, and so it's not just a simple in and out type of weight loss program. We have a lot of guidance offered. We have invested in a really expensive weight machine, our shape scale, which is equivalent to a DEXA. So we're really tracking muscle loss. It's not just about injectable weight loss programs. So I just like to advocate and plug for that, and all the nutritional things that Allie can offer, along with MRT, gut health testing, and the peptides that we offer are really only FDA regulated peptides. So important. I think that's a really important topic, and I think there's a lot of buzz on peptides, and I think there are a lot of unsafe places that you can obtain peptides online. And so I'm not necessarily advocating that, patients need to come to us for peptides. It's just understand where your peptides are coming from, and it really should be FDA regulated. We offer NAD. And then we have a whole sector of like body contouring machines, which actually we didn't talk about that. So we do have an Emsella chair that really helps with urinary incontinence, urinary frequency, urge incontinence. So a big game changer for women. And then our machines that help with the Neo M Sculpt, which helps with enhancing muscle, reducing fat, and complementary for patients that are losing weight. And so really helps you kind of retain and build muscle. So we offer a lot of different things, and on the horizon, hopefully, is like some genetic testing and biomarkers. But we do a lot, and so we're advocates for our patients. So I think that's
I would agree.
Yeah, a lot of just great options, different things to try out and learn more about. So I'm super excited for you guys and the new things to come in the future as well. I want to thank you both so much, Monica and Erica, for joining me on the podcast today and sharing your knowledge, passion, and just inspiring stories with us. I wish you both the very best in all that comes your way in the future.
Thank you. I appreciate it.
Yeah.
This was not as bad as I thought.
Thank you. I'm so glad.